Hello everyone and welcome to this session on integrated public health analysis in humanitarian emergencies. My name is Woodward. I am the manager of the public health unit for impact initiatives based here in Geneva. In today's session we're going to talk a little bit about integrated public health analysis. What do we mean by that exactly? We're going to present a case study and the findings of that case study when we conducted such an analysis in Somalia last year. And then we have the Somalia country coordinator, Jack Palazzo, on the call as well. And he's going to present the impact of that analysis and what effect it had on the response at country level. So in the context of the humanitarian architecture, we can define public health as primarily relating to the following four sectors: food security, health, nutrition, and WASH. In these sectors, humanitarian assessments and analysis often aligns with the sector-based structure of the response. So health assessments tend to focus on health. Food security, the dominant aspect tends to be on food security, and the same for nutrition and the same for WASH. But this is despite the recognition by actors within these sectors of the interconnectedness between them. And we know that this is true because of the different conceptual and analytical frameworks that exist that lay this out. So if we look at the IPC analysis as an example, we can see that WASH and health for both IPC acute food insecurity and IPC acute malnutrition. WASH and health are considered as contributing factors. They contribute towards food security and nutrition outcomes. But the nature of organizational priorities or of things like mandates means that the focus of the analysis that is conducted still tends to be dominated by individual sectors. It's not the truth in all cases, but I think it's probably fair to say it is true in most cases. And the risk of this is that when we have complex, multifaceted, multidimensional public health crises like we do in many parts of the world today, we often don't address the full picture with our analysis, with our assessments, and it means the response is not fully integrated either. So why does this matter now? Well, as everyone here knows, we're in the middle of unprecedented disease outbreaks globally. With cholera, we still have outbreaks of Ebola emerging last year. And not to mention COVID, of course. We have the largest food crisis in modern history. We have widespread climate emergency, exacerbating drought, flooding events, and the impacts that those things are having. And the impacts are siloed in very few cases. Okay? Cholera doesn't care about the cluster system, and drought doesn't care about organizational mandate or an organization's strategy. These shocks have both direct and indirect consequences across all aspects of life and can contribute to adverse public health outcomes in many ways and in many acute ways as well. And this includes by heightening the risk of excess mortality. So while of course individual sector and individual sectoral responses continue to matter, we believe it's also critical to start to tackle these things in an integrated way. And to do that, we really need to start understanding them in an integrated way. So I'll just pass over now to Jack Palazzo, our country coordinator for Somalia, who will maybe put what I've just been explaining into tangible terms.
Thanks, Will. Indeed, in Somalia, we have seen a huge need to take this kind of approach and are starting to see how valuable it can be. In the July 2022 IPC, we saw extremely concerning outcomes with elevated malnutrition and mortality in several areas. However, we noted that the IPC analysis was finding that food security outcomes were not really matching the malnutrition and mortality outcomes. So we decided as Impact to conduct an integrated public health analysis of these particular areas, namely Baidoa and Burhakaba, to really try to understand what was happening and what the drivers of some of the outcomes were. The following video produced by our teams at the time shows the results.
Somalia is currently experiencing unprecedented drought conditions following 4 consecutive failed rainy seasons, the worst in over 40 years. Prolonged drought has resulted in water sources drying up, the loss of livestock, and rising water prices, all of which are hampering food production and placing immense pressure on already vulnerable communities' ability to access food and water. This latest crisis is not occurring in a vacuum, but rather is compounding the protracted needs and vulnerabilities of populations that have been experiencing decades of conflict, displacement, and recurrent climatic shocks. Humanitarian conditions are particularly concerning in Beidoa and Burhakaba districts, where elevated malnutrition and mortality rates have surpassed emergency thresholds.
Acute malnutrition at this level really increases the risk of excess mortality, which we are already seeing, as crude and under 5 mortality rates have both been assessed above World Health Organization emergency thresholds, reiterating just how alarming this situation is.
In Baidoa, a known cholera hotspot, 2,033 suspected cholera cases were recorded between the start of 2022 and the 10th of July. In Burhakaba, a new spike of cholera cases was recorded in April. These figures are from mostly accessible areas. Cholera infection rates and mortality in similar conditions in 2017 were found to be 4 times higher in inaccessible areas. The cause of death in many children in previous crises in 2017 and 2011 has been disease outbreaks, frequently diarrheal disease.
Globally, one of the minimum humanitarian standards for adequate latrines in camps and sites is a maximum of 50 people per latrine. Out of 340 IDP sites in Baidoa and Burhakaba, 83 have no sanitation facilities at all, and 237 do not meet this minimum standard. Inadequate wash and health environments exacerbate risks related to waterborne and other infectious diseases, such as cholera, and it increases the severity of those illnesses. And what we really need to remember is that people arriving in IDP sites and urban centers are already vulnerable due to prolonged drought conditions.
These findings clearly point to the need for an immediate scale-up of wash and health assistance in Beidoa and Burhakaba, specifically increasing access to adequate quantities of safe water, sanitation interventions, and both preventative and treatment health services.
The results of the analysis were provided to the Famine Review Committee that was convened following the IPC analysis and the classification of potential famine conditions in these particular areas. The FRC found the IPC classification of Phase 5 famine plausible for the projection period, providing an overall Phase 5 likely classification. What is interesting is that the FRC's conclusions echoed the findings produced in our analysis. They said there will be a continuation in the cholera and measles outbreaks with the possibility of a resurgence in case numbers given the low coverage of vaccination and water supply, sanitation and hygiene services. Combined with high levels of acute malnutrition, this will result in an elevation in the risk of mortality. Limited further scale-up of WASH, nutrition and health interventions will occur due to limitations in resource allocation and political security response capacity and logistic impediments. Overall, having been through the IPC and FRC processes, we found that focusing on the interplay between WASH, health and nutrition needs and specifically emphasizing how that affects excess mortality, especially during times of drought, has been invaluable in guiding key humanitarian partners in their decision-making and response planning.
Thank you, Jack. So what we learned from Somalia is that taking a step back and trying to understand the situation in a holistic, integrated way is critical for advocating for and delivering the most appropriate and effective humanitarian response. This isn't to say that there's no need for strong, in-depth sectoral analysis, and I think there's always a need for that, but rather looking at issues from multiple angles can really help shape a more coordinated, more cohesive, and ultimately more effective humanitarian response, especially in settings where there is such small margin for error. This isn't something that is done easily either, and we can tell you that from our experience. It will also require a lot of research to actually fully understand the interlinkages between these different aspects of public health. But we really do see huge value in this type of integrated analysis, and hopefully you do as well. So that's our presentation for today. Thank you very much for listening, and we hope to discuss this with you all more in the future. Thank you.